All right, looks like we've got some interesting stuff to dive into for this deep dive. We've got a pretty wild mix of sources here. Weekly marketing themes, insights into those underserved hospice markets, and even a guide to like navigating tricky client situations. So, ready to uncover some of those hidden gems.
Oh, absolutely. I'm really excited about this mix. It seems like you're really thinking strategically, going for those quick wins, but also looking at the long game, for sustainable growth and all that.
Yeah, I think that's the goal. So let's just jump right in, huh? Starting with these July marketing themes. Some of these are so out there. Like week 26, it's all about patriotic celebrations for seniors. We're talking victory gardens, trips to fireworks shows, even sing-alongs at VA hospitals.
Oh,
Oh, and then there's this whole thing about serving red, white, and blue pudding pops. Like it's such a weirdly specific detail. I don't know, it just makes me smile.
it's it's definitely creative, right? But beyond the cuteness factor, there's some real psychology at play here. A lot of seniors, they have these strong emotional ties to patriotism.
Oh, yeah.
Think about it. Like think back to those times, maybe during their youth. There's this sense of purpose, right, and community. So these activities, they kind of they tap into those feelings, right, and they offer seniors a chance to relive those memories and build connections.
Yeah, that's true. It's not just about recreation then, right? It's like meeting some deeper emotional need.
Exactly.
Okay, so then week 27, total
Yeah.
change of pace. National Hot Dog Month.
Hot dogs.
Yeah, hot dogs. And the source is suggesting like setting up booths at baseball games, even hosting a hot dog barbecue safety class.
So smart. See, that's a perfect example of staying relevant, right?
Yeah.
You're
Yeah.
leveraging what's already happening, what people are already thinking about.
Yeah.
And, July, it's hot. So weaving in those heat safety tips, it's practical, subtly shows you're looking out for them, looking out for your clients.
Definitely. Okay, week 29. Everybody deserves a massage week. This one, they suggest partnering with massage therapists and having these events for senior groups. They even suggest doing it at like physician offices. Now, that's an idea I never would have thought of.
Yeah, it's creative, right?
Yeah.
But it really highlights the power of these strategic partnerships. When you team up with other businesses, you can tap into these new audiences, offer services you couldn't do on your own.
Yeah.
Plus, I mean, come on, who doesn't love a massage?
Right.
It builds goodwill, positions you as a company that cares about wellness. It's a win-win.
Definitely a win-win. Okay, you ready for this one? Week 30, Christmas in July. We're talking like adopt a senior programs, movie nights, maybe even like caroling. In July, I mean, I love the holidays as much as the next person, but in July, this is like next level thinking outside the box.
It is, isn't it? But that's exactly why it might work. It's unexpected, memorable, and it taps into, those warm, fuzzy feelings everyone loves about the holidays. And for seniors, especially if they're feeling isolated, especially during this summer when everyone's busy with, vacations and stuff, it could be really powerful. Combat loneliness, create a sense of connection.
Yeah, it's true. I'm noticing like a trend here across all these weekly themes. There's a real focus on uh senior specific activities, right? Like they really, really get their target audience. They get what seniors are into.
Yeah, they're not just throwing out like these generic marketing messages, right?
Yeah.
They're tailoring the activities to what seniors actually want, what they need.
Okay, let's move on from hot dogs and Christmas trees. WIT 28 is a completely different vibe. Eye Injury Prevention Month.
Okay.
They suggest marketing to ophthalmologists offering eye health classes, which, it's a good reminder that home health isn't just for the elderly, right? There's a whole range of services and clients out there.
Exactly. And if you want to grow, you have to broaden your audience, right? Broaden your services. And
Mhm.
focusing on preventative care, it positions you as like proactive,
Right.
A partner in their health, where it appeals to, a wider range of people.
Now, this brings us to a whole other area, hospice care. This source really zeroes in on those underserved markets, and they get super specific here. There's this whole list of like 16 clinical indicators and 3 different functional assessment classifications. This is serious, in-depth stuff.
Yeah, this level of detail, it really highlights the need for specialization, targeted marketing within the hospice space. You're not just promoting hospice care, you're identifying these specific patient populations, each with their unique needs, and you're tailoring your message, tailoring your services to those needs.
They highlight 9 underserved markets in total. Children, corrections, disability, disease-specific, ethnic, faith, geographic, veterans, and workplace. I mean, wow, right. It's amazing how many different contexts there are for hospice care.
It really shows you, you have to go beyond traditional marketing, find ways to build bridges between uh, hospice care and communities that maybe, don't know much about it or don't have access.
Yeah, and they really dive deep into that disease-specific hospice marketing, pointing out that, like, specialists, they need these reminders about the benefits of hospice for their patients.
Hmm.
And then general practitioners, they need educational materials to help them, identify patients who could benefit. It's all about keeping everyone informed.
Absolutely. I mean, healthcare professionals, they're bombarded with information all the time, right? So if you want to get their attention, you got to be clear, concise, and relevant. Make
Yeah.
sure your educational resources are actually useful. That's how you drive those referrals. That's how you make sure patients get the right level of care at the right time.
Okay, let's switch gears now. Let's talk about something that honestly every business deals with, but it's especially important in home healthcare, client relationship repair. Because even with the best marketing, things go wrong.
Oh yeah, things happen.
Yeah.
And it's how you handle those situations that really makes the difference. I mean, retaining clients is just as important as getting new ones, right?
Mhm.
And when you go above and beyond to, provide great service that builds trust, generates those referrals, all that good stuff.
This source is pretty straightforward. They tell you to, like, take immediate action when a problem comes up, involve the higher ups to show you're serious, focus on solutions instead of pointing fingers, and follow up like diligently. They even have this 11-step checklist for overcoming those mishaps.
Yeah, I like the analogy they use here about equipping a sales team for duck hunting. They're like, you can give them all the fancy gear in the world, but if you don't teach them where the ducks are, it's useless. It's
Right.
the same with client relationships. You got to give your team the skills, the support they need to really build and maintain those strong relationships.
It's a good reminder that marketing isn't just about like attracting new clients, it's about building those lasting relationships. And that means owning up to mistakes when you make them and taking those concrete steps to make things right.
Yeah, it's about that holistic approach.
Yeah.
It's not just flashy campaigns. It's about building a reputation,
Yeah.
for quality care, being responsive, and a genuine commitment to client
Yeah,
satisfaction.
I like
A
it.
commitment to client satisfaction. That's key.
This source recommends addressing client issues within 1 week of the problem,
Yeah.
happening. And they really emphasize bringing in someone higher up, like an administrator, branch manager, to show that you're really committed to fixing the issue.
It reinforces that client retention. It's everyone's responsibility,
Yeah.
from the frontline staff all the way up to leadership. It's about creating that culture, right,
Mm.
of accountability, responsiveness throughout the whole organization.
All right. So we've gone over those patriotic pudding pop.
Pudding pops, yeah.
We've talked about Christmas in July. We've
Mm.
tackled those complex clinical indicators. We even got into the art of client relationship repair. I think we've covered a lot of ground here in this deep dive.
We have. But you know what? What's really striking to me is how all these topics, as different as they seem, they're all connected.
Oh, yeah.
They all point to this need for a more strategic, holistic, and human-centered approach to home health marketing.
Yeah, it's not just about selling services, right? It's about
Mhm.
relationships. It's about those genuine connections. It's about, making a real impact on people's lives.
Exactly, and that's what makes this work so rewarding.
We've got one more section to go in this deep dive where we're going to really dissect those weekly July marketing themes and pull out those key takeaways that you can actually use. Stick around.
Welcome back. As we keep digging into this stuff, what's really standing out to me is this idea of understanding your audience.
Yeah.
Really responding to what they need.
Oh, yeah, yeah.
Whether it's those senior-specific activities or developing those materials for, healthcare professionals, it's all about meeting them where they are.
Yeah.
Providing something that's actually valuable
Yeah,
really makes a difference.
I agree. And speaking of meeting people where they are, let's circle back to that list of those underserved hospice markets.
Okay. Yeah.
We've got children, corrections, disability, disease-specific, ethnic, faith, geographic, veterans, workplace. It's kind of a wake-up call, right? Shows you how diverse the hospice community really is and how we need, different approaches for each one.
Absolutely. Each one has its own needs. And,
Yeah.
this highlights the opportunity to create like really targeted programs, really catered to what each community needs.
Yeah. And the source, they stress the need for like really customized outreach and education, no more one-size-fits-all approach.
Right,
It's
right.
not just, promoting hospice care in general. It's about understanding the nuances of each group.
Their concerns.
Yeah, their concerns and addressing those.
So then the question is, how do you actually reach these communities?
Yeah.
How do you break down those barriers to accessing care?
It's a big challenge. One thing that stood out to me was partnering with like faith-based organizations,
Oh, yeah.
community groups, building that trust, providing care that's sensitive to their culture through connections they already have, connections they trust.
Those existing connections. Yeah,
Yeah.
absolutely. Because, there might be some misconceptions, some concerns about hospice care within certain communities.
Mm-hmm.
So working with, leaders, organizations they trust, it allows you to connect on a deeper level.
Yeah. It's all about building those relationships.
Exactly. And another thing, and it seems simple, but it's
Yeah.
so crucial, providing materials in different languages
Right.
and accessible formats.
Yeah. Easy to overlook that stuff, but it can make a huge difference for people.
Huge difference. It really speaks to, cultural competency,
Yeah.
a real commitment to inclusivity, meeting people where they are, physically, but also in terms of their background, their culture.
Mm-hmm. Let's dig a little deeper into that disease-specific hospice marketing. That was a big focus in the source.
Yeah.
They even provide this list of like 16 clinical hospice indicators, things like weight loss,
Mm.
decreased functional status,
Wow.
recurrent infections. It really highlights how much clinical expertise you need for this kind of marketing.
Right. It's not just about the emotional side of end-of-life care.
Yeah.
It's about the clinical side, too. It's about making sure that, healthcare professionals understand the specifics so patients get the right care at the right time.
They also mentioned the three major functional assessment classifications. I have to admit, this part got a little technical for me. Palliative Performance Scale, Karnofsky Performance Status, and ECOG Performance Status.
That's okay. You don't have to be a doctor.
Right.
The key takeaway here is that your marketing folks, they need to work closely with the clinical experts
Yeah, makes sense.
to develop those messages that resonate with doctors. Understanding these indicators, these assessments, it helps you target your efforts, reach those doctors who are, more likely to refer patients.
Yeah, so it's about finding that balance.
Right.
You want to talk about hospice care compassionately. It's a sensitive topic.
It is.
But you also need to be clear about the clinical stuff.
Yeah, you got to get the facts straight. It's about understanding both sides,
Call both sides, yeah.
the emotional side and the clinical side, and then translating that, into messages that make sense for different audiences.
So thinking about all these underserved markets, it feels like there's a huge opportunity here, right? To do some good.
Huge.
But we need to move beyond those like traditional marketing methods.
Absolutely. It demands a more targeted approach. You got to get strategic. It's about engaging with communities, being aware of cultural differences, and really understanding the clinical side of things. It's about working together, being creative to connect with people who, might not be reached through those typical channels.
It's about, like you said before, building those bridges,
Yeah, sure.
creating those pathways to care for people who might otherwise, fall through the cracks.
Exactly. And at the end of the day, it's about expanding access to care,
Mm-hmm.
to compassionate care, supportive care for everyone who needs it, no matter what their situation is.
Now, switching gears a little bit, let's talk about those private pay home care referrals
Okay.
and how important it is to keep your clients happy, especially when there's so much competition out there.
Right, right. Client retention. It's huge. And you know what I like about this source? They don't just talk about fixing problems. They talk about seeing those mishaps as opportunities
Yeah, like that.
to actually build stronger relationships.
So like turning a negative into a positive.
Exactly. They talk about, taking action quickly, bringing in the higher-ups to show you're serious, focusing on solutions, not on blame. It's about taking responsibility and really showing your clients that you care.
They even have that 11-step checklist.
I know, right? It's
Yeah.
very practical.
For dealing with those sticky situations. But basically, it boils down to, communicate openly, be transparent, and be committed to making your clients happy.
And I love the analogy they use.
Oh, yeah. Which one?
They compare it to like equipping a sales team for duck hunting.
Okay.
They say you can give them all the fancy gear, right?
Yeah.
But if you don't show them where the ducks are, what good is it?
It's true.
Well,
They're not going to hit anything.
exactly. And it's the same with client relationships. You got to give your team the tools, the support they need to succeed.
Yeah. Yeah, train them.
Yeah, train them. Give them guidance,
Yeah.
resources, so they can really master that whole client relationship management thing.
It's a good point. Strong relationships, they're not just about, like, closing deals, right?
No, no. It's about trust,
Mutual respect.
building a partnership,
Yeah.
a real partnership.
And it's like every interaction, every little thing you do, it's either building that trust or it's, chipping away at it.
It's true.
Yeah.
And sometimes those moments where things go wrong, those are the moments where you can really show your clients how much you care.
Yeah, how committed you are to making things right.
Yeah. It's about shifting your mindset
Oh,
from just thinking about transactions to thinking about relationships.
I like that.
Yeah. Every interaction, it's a chance to strengthen that bond with your client.
So we started with patriotic pudding pops, right?
Big bumps.
And we talked about Christmas in July. We even got into those complex clinical indicators and how to repair those client relationships. We covered a lot.
A lot of ground, yeah.
What's the biggest takeaway for you from all of this? What are the core principles?
For me, it's got to be creativity, collaboration, and understanding your audience.
Yeah.
Really understanding them. It's about, going beyond those generic approaches.
Yeah.
Find ways to create experiences that, they'll remember, that mean something to
It
them.
can feel good.
Yeah, it's about that human connection.
I couldn't agree more. It's about being relatable, putting some personality into your marketing and showing your clients that you genuinely care about them.
And that's what sets apart those successful home health companies.
Yeah.
It's not about just selling services. It's about building those relationships, those real lasting relationships built on trust, shared values, all of that.
Okay, we've got one more section to go in this deep dive.
All right.
We're going to take a closer look at those weekly July marketing themes and really pull out those key takeaways, things that you can actually use.
It's practical stuff.
Practical stuff. Stick with us.
All right, welcome back for the the final stretch of our deep dive. We've gone over a lot, but now let's really zero in on those weekly July marketing themes and see what we can learn. See if we can get some actionable insights for your home health marketing.
Sounds good.
Okay, so week 26, right? Those patriotic celebrations, it might seem, I don't know, kind of silly at first.
Yeah.
But you were saying before there's actually some smart strategy behind it, right?
Oh, yeah, definitely. Tapping into those emotions.
Yeah, the emotions seniors have with patriotism.
Exactly.
It's not just about throwing a party.
No.
It's about creating an experience that really means something to them.
Right. Like those victory gardens, they're not just about, planting tomatoes. It's about purpose,
Oh, yeah.
community, connecting with history.
And even those pudding pops,
Oh, yeah.
red, white, and blue.
I love that detail.
It's just a little touch,
It is.
but it makes it more memorable. It's those little touches, right?
Yeah.
That make people feel, special, cared for.
Yeah, exactly. Okay, so week 27, National Heart Dog Month. It seems, I don't know, kind of random to build a marketing campaign around, but it shows you how important it is to stay relevant.
Stay relevant. Yeah, pay attention to what's going on.
What's already on people's mind.
Exactly. And by adding those heat safety tips, you're not just, hopping on a trend. You're showing that you actually care.
Yeah, showing that you're thinking about their well-being.
It's marketing with a heart.
Okay, so week 29, everybody deserves a massage week. This is where those partnerships really come in. Teaming up with massage therapists, it just opens up so many possibilities.
It does. It does. And you're thinking outside the box, right?
Yeah.
You're finding these creative ways to provide real value to your clients.
Yeah.
Yeah.
And it positions you as, the company that cares about wellness, about self-care. Who doesn't want that?
Exactly. It appeals to everyone.
And then we have week 30, Christmas in July. I still can't get over that one.
It's a good one, right?
It's so out there, so unexpected. And it taps into those good feelings everyone has about the holidays.
Exactly. It's playful. It's memorable. And, for seniors who might be feeling lonely, especially during the summer, it gives them a chance to connect.
Yeah.
To feel that joy.
Yeah, to feel like they belong. So I guess looking back at all these weekly themes, what would you say is Biggest takeaway.
The biggest takeaway. For me, it's about being creative, collaborating with others, and really, really understanding your audience.
Yeah,
It's
yeah.
about going beyond those generic tactics,
Mm.
finding ways to create experiences that are, meaningful,
Yeah.
engaging, memorable.
It's about being the human connection.
Human connection, yeah,
Couldn't
absolutely.
agree more. It's about being like relatable,
Oh,
putting some personality into your marketing
yeah.
and showing your clients that you care about them, that you really care about their well-being.
And that's what it takes, right, to really stand out in the home health space. It's not
Mhm.
just about selling your services. It's about building those relationships, those real connections that last.
Built on trust.
Trust, yeah, shared values, all that good stuff.
Well, on that note, I think we've reached the end of our deep dive.
We have.
But before we go, I want to leave you with one last thought. We talked about the importance of reaching those underserved markets.
Mm,
Children, veterans, people in correctional facilities, so many others.
it's a big challenge, but it's also a huge opportunity to, really make a difference, help people access that compassionate care.
So as you think about everything we've talked about today, I want you to ask yourself, which underserved market speaks to you? Which one resonates with you? And how can you use what we've discussed today to reach them, to provide them with that support they need? It's a question we're thinking about.
It is. It is.
Thanks for joining us on this deep dive. Keep learning, keep exploring, and keep making a difference.
See you next time.